everybody and welcome to the presentations of our group project. Today, we will present you about a physical therapist who has an inspiration from smiling and happiness from a patient. A breakdown of the interviewee. Our interviewee name is Pachayathanan Siri Nitikon. She graduated from St. Francis Xavier Convent in 2009 and graduated bachelor degree in Physical Therapy Mahidol University in 2015. Now she is a neurology and orthopedic physical therapist at Ganya Physical Therapeutic Clinic.
Now let's talk about what is physical therapist. Physical therapist is a career that treats and recovery regarding human movement disorder. With the physical therapeutic technique and appropriate equipment, in the present, physical therapist is responsible for treating, rehabilitation, and preventing from the disorder that's caused from some disease and some disorder. Now let's see what the physical therapist always do when the patient comes to see them with the pain. It can be summarized into 3 easy steps. First, they will diagnose and assume what is the process of the pain and find out how to reduce the pain. And then they will give some treatment and some suggestions for enhancing about the physical functional abilities of movement. And finally, step will prevent the causes of the pain that will come back to the patient. So physical therapists not only treat the pain of the patient but also restore, maintain, and promote the suitable health condition. Physical therapy can be divided by disorder into 4 major steps. The first is muscular and skeletal disorder. It is actually about the pain of the muscle, the broken bones such as the back and neck pain, ankle sprain, and office syndrome. The next is neurology disorder. It's actually about the brain and the nerve cord. The neurology physical therapist always treat the patient who face the hemiplegia, stroke, Alzheimer, muscle weakness, and the Parkinson's disease. And the next is cardiology. It's actually about the heart and vascular system. The patient who face the infection at the respiratory tract and some of post-surgery cardiovascular patient. And the last is pediatrics patient. It's always about children who face the pain and some of the delayed development. Nowadays, physical therapists can be work in the sport team such as the football team, basketball team for helping them to reduce the pain and promote the health of athletes.
Daily basis of physical therapists. In education, during the freshman year, studying about general science courses such as physics, biology, chemistry, and mathematics. In the second year, anatomy course take an important role in this year. And the last year, they have to do thesis and practice with the patient through the year. In work, first of all, greeting to the patient and then getting the patient's information and assuming the probability of disease. Next, treating, and the last, offering the patient about self-take care and regulations.
Strengths and weakness of being a physical therapist. Strengths being of physical therapists are to hand treatment such as method or equipment useless. Thus, they are reduce the risk of using an equipment or that's useless. Weakness of being a physical therapist is having unchecked evidence, including X-ray film or MRI photographies. For this reason, physical therapy has to be careful in diagnosing and treating in patients. Frequently, obstacle in career is the patient lacks of confidence in a physical therapy and the patient doesn't give the participation in treating. Example, not giving some information which have an effect on treating. The patient doesn't both off exercising and changing the bad habits. Difference between doctor and physical therapist. Doctor and physical therapist have a distinctive responsibility. Doctor treats the patient with medicine and surgery, but physical therapists treat the patient with physical therapeutic methods. Examples: moving the joint, exercising. Although doctor and physical therapists have a difference, but both of them want to the patient's happiness.
Differences between a student life and a working life, especially many less possibilities, because when the life is going to be working life, which is not only take care of many patients, but also manage the organization. Furthermore, working life depends on patient expectation. Accordingly, physical therapists have to always improve themselves and discover a new effective method of treating patients. For students who are studying in Faculty of Physical Therapy, they should have an accuracy knowledge, because all of 4 years that you have learned in Mahidol University, you can bring all of knowledge that you study can bring as a tools or arms for your working. For children who are interested in Faculty of Physical Therapy, first, you should have a point and read books every day. Moreover, you should have an accuracy knowledge and finding what you want to be and keep working for the future.